This webinar series hosted by GPN Technologies is called Next Steps. It's been providing a real practical roadmap to getting your eye care business back on track. And this is the 5th of the sessions that we've had. All the other sessions are available at iThrive.net, and we hope that you'll visit and watch those that have already been recorded. This session is called Dispensing Amidst Social Distancing, and is going to focus on all things optical. We have a very robust panel of experts, and I'm really excited to help to introduce them. First, I want to make sure we note our sponsor, ClearVision. We're very grateful here at GPN Technologies for ClearVision's support of the Next Step webinar series. My name is Scott Jens. I'm a doctor of optometry, and I've served as a senior executive coach to the GPN's technology team as part of my executive business coaching service called Sandbox. And my panel of experts today include 3 people. First is Dr. Susan Keene. She's the owner of Envision Eye Care, a multi-location practice in Virginia and Tennessee, and she's a practice management guru and has expertise in low vision. Dr. Larry Golson owns another Envision Eye Care in Asheville, North Carolina, and is a practice management consultant under the brand Harmonize Practice Management Solutions. And then we have Mark Hinton from Bristol, Virginia. He's CEO of his optical consulting business, I Facilitate, and his passion is around improving processes with the patient. Really appreciate each of you for being with us today to share your time and your expertise. Thanks for being here.
Thank you.
Delighted.
Now, we have 4 areas of discussion that we're going to weigh in today. And as we always tell our attendees, we've got hundreds of people on the line showing the interest in this area. We're going to talk about this reopening mindset around 4 areas: patient handoff, optical dispensary arrangements, leveraging vendor relationships, and social distancing matters in the optical particularly. So let's go ahead and get started. So first of all, Mark, let's start with you, right? We've got, this doctor and optician handoff process. We're just getting back. What kind of things can we do in the optical to influence patient decisions and make sure communication between the doctor and the optician are giving the most cohesive message, accentuating the things you've already had, but now in this new era of social distancing, how are we going to do it better than we have before?
You know what? Thank you, Dr. Jens. I would share with everybody, and Dr. Golson and also Dr. Keene both know this. We're going to see people with discretionary dollars and thinking about how they're going to use those dollars. And certainly we've seen a lot more advertising on TV for choices that patients have, to purchase eyewear. So a few things that will be very important is that the handoff in the exam room should be directed at the patient, not at the optician, for one, because the patient has to buy in either the first time or again in the exam room, and simply not removing words like we talked about or we discussed, she might want more information on, and simply moving away from recommending and actually prescribing to the patient. And then having the patient understand that the optical expert is simply going to match what's being prescribed. So this will be very, very important going forward. Something prior to that handoff is to gain the patient's acceptance of buy-in by asking a question. Does this sound like a simple way for you and I to be sure that we're going to keep your eyes free of sun damage until you see me again? Closing, in other words, is very, very important, and typically we're not good at that. And the reason that I share that with you in closing on this particular subject topic right here is because when the patient buys in the exam room, they're actually more likely to fill it in optical.
So let's go to this, Susan and Larry. We know that our patients have been out of work. There's a different ability to pay, right? There have been some that have been very busy working. So we've got this very, sort of disparate approach. We don't know how to prejudge. We shouldn't prejudge. How are you going to each connect with your patient to think about how to prescribe for their needs and to assess their willingness to buy?
Right. So I think you make a good point. When I sit at home thinking about I'm getting ready to open my doors again, what am I going to do differently? What might I still do the same as what I did pre-COVID? The first thing that came to me was, first of all, don't judge the patient's pocketbook. Because a lot of our patients have been working overtime and they're working in industries where they have been very busy. They've not been furloughed. The second thing I thought about is my own demographic. So we have 4 locations. We are in a very rural part of Southwest Virginia, Northeast Tennessee. Our median income in our towns averages around $30,000. So even pre-COVID, I was very aware of the fact that my patients, by and large, were very discriminating about the dollars that they would spend. And so one of the things that we started doing specifically was working on our handoff to the patient. I'm kind of ashamed to admit it, but for years I would do the exam and I would talk about all these, fabulous medical things. And then I would simply, allow the patient to go out to optical, and I might say something to the optician like, here's Mark, I'll let you help him with his glasses. I mean, it was 100% incumbent upon my optician to have the sale. And when I really started looking at it along the lines of, I'm a doctor, I'm prescribing, and my optician is my optical pharmacist. They're going to fill my prescription. Then I really started thinking of how I could make use of all the great medical technology that we have that sets us apart. So literally at the end of every exam, I will pull up OCTs, I'm pulling up VEPs and ERGs or whatever, and I am saying to the patient, here's what we're seeing inside your eye. Here's my prescription. Here's what's going on with your vision. I'm prescribing a light adaptive lens for you because we're starting to see these early signs in your retina. It's going to be super important that we follow this prescription to a T. That way, when I see you back next year, we won't see any further damage. We're all, I'll tell patients a lot of the time, if I do a good job today, you're going to see well. But if I do a great job, I'm going to give you the tools to see well for the rest of your life. I feel like when we have those kind of conversations with patients and we make it about, I'm prescribing, I'm not recommending, and here's why you need this specific prescription. It's not a generality, it's specific. Then they leave the exam room. And to Mark's point, I'll usually say to the patient, does that make sense to you? When you've got that patient in front of you nodding their head, then I know I'll call the optician in and kind of repeat the prescription, in that handoff. So now the patient has heard it twice. And then my opticians will tell me when my patient gets out to optical, they're like, now I'm not having to say, did Dr. Team talk to you about? They were there with me. They've heard everything. And it just makes it so much easier.
Larry, let me have you take the
top of that.
Oh, go ahead, Mark.
If I could just tag on top of that too. It's really important that at that point, what the optical expert is doing, that optical pharmacist, is really mimicking the doctor. Not saying, let me explain, or have you heard of, or have you ever considered, have you thought about, if you were thinking you wanted, let me explain but simply being able to say, we understand what Dr. Keene has prescribed for you. I'll make sure that happens. I'll be sure there's a perfect match. Again, it would be wise for as well, since in this particular stage that, the optical expert, if the handoff is in the exam room, is walking in with a small pad in hand to make specific word notes the doctor used, because frankly, the patient is buying the doctor. And as soon as the optician stops sounding salesy, it's more likely that the patient is going to buy in. Thank you.
Sure. Larry, let me have you take, if you don't mind, the other side of the coin, right? Not the patient who's been working overtime and is willing to buy, but there's going to be a lot of patients that this group of participants that's joined us today, again, hundreds of attendees here, saying, there's a lot of patients who aren't willing to buy. Talk a little bit about the mindset that you have to take with them and how your team needs to think about communicating with them.
Yeah, thanks, Scott. I think that mostly we have to consider how we address the patient when we start working with them. And that's, from the moment they either call to make an appointment or step in the office, and, asking them how they've been doing, just starting an open, frank conversation to understand, have they been out of work? Have they been working overtime? You kind of understand what their current situation is, because others have been seriously affected by this situation. And I think the ingredients of success for the office and how it relates to the optical is to have a solid communication process amongst the team. There's multiple ways to accomplish that, and different point of contacts with the patient along the way for the patient journey. I would say also, we'd love to hear from the audience and those that are joining us live, what practices they're currently using that influences the success of communication with the staff, and what challenges they may be experiencing. Because in my office, I know what we've been doing is we've been opening up that question, that same exact question, what do we do with patients that might be struggling to our team who is actually, you know, kind of problem solving that in a safe environment so that they can think about ways to engage the team, to respect the fact that they may be struggling, but yet also, to Dr. Keene's point, not to shy away from prescribing something that might be important for them. Because, I mean, and as an example of that, digital eye strain, so many people are on so many more webinars. Look at all of us right now. And so we have to be thinking about that in terms of how we can help our patients. So I might even say something if I've kind of sat down and started a conversation to see where the patient's at. In a perfect environment, this is what I would prescribe to you. And I would actually say this during the handoff, and I do want to mention the handoff, how we do it in our office, and I know Dr. Keene does this as well, is the optician actually gets paged and walks into the exam room at the end of the exam to have that handoff, the clear handoff of the baton from the exam into the optical, so that it's a seamless transition and it doesn't feel like we're going from clinical to now we're going to try and sell you something. And so as we have the optician come in and be a part of that conversation, I might say something like, in a perfect world, this is what I'm going to prescribe to you, these 3 things, whatever the case may be. And then Stephanie here, my optical expert, is going to help you prioritize that so that it meets your budget and your needs at the same time. Right. So that would be something that Stephanie would then take into the optical and say, this is what Dr. Golson prescribed. You know, how are you doing? Like, let's check in with, you know, what life is like for you right now, and then base her conversation moving forward on that.
Mark, I see you'd like to make a comment.
I do, in regard to both Dr. Keene and Dr. Golson, with the hope that we do get the optical expert into the exam room. Where we don't get the optical expert in the exam room, and we're going to hand off either to the scribe or a tech to take to optical, it's very, very important that the scribe or the tech mimics what the doctor prescribes specifically. Many opticians will hear, she had a little change in her prescription and she might be interested in sunglasses. And that is dead in the water. And so it's very important that the patient is hearing the same dialogues and the same importance also attached with why. And to respect with Dr. Golson, the patient, you know, the patient needs to hear what he said. They need to understand why it's important for them. Not that it'll stop UV rays, because most patients don't know what a UV ray is, but it will eliminate the wavelengths that can lead to sun damage over time. So it has to relate to the patient consumer mindset. Thank you.
You know, each of you have really complemented what the Next Steps I Thrive webinar series has been promoting over the course of the entirety of the webinar groups, which is providing a safe and respectful environment for patients. And the 3 of you are real experts in dealing with handoff, and there's so much more that the attendees could reach out to you for after this to talk more deeply about handoff standards outside of the COVID era. But right now, back to that safety perspective, there's going to be a patient. I'd like each of you to sort of address this, maybe even play it as a role play, right? Where I say, hey, listen, I just can't, I need to go to Costco. Right? I need my prescription. I'm sorry. I trust you, doctor, with my exam. I trust you, optician, with, you know, adjusting my eyewear, but I just don't want to become totally clean with you that I'm really struggling financially and I perceive value somewhere else. Would each of you take a chance here briefly to talk to the patient and give some guidance, some real guidance to, you know, how you do that? So, you know, you're documenting the things that have already been said. That's great. You each made great points. But now give the patient a reason to say, okay, that's a safe, this is a time where I need to be thoughtful to you. Go for that. Go for that role play.
Yeah, I'd be happy to start off that one. As far as that, Scott, for one thing, I think it's important to realize that any one of my team members could be posed with that question. So from patient care coordinator to doctor to medical assistant to optician, you know, anybody can get that question about, hey, I just want to get my RX so I can go get glasses somewhere else. And I think that, you know, what we've done in our office that has been helpful is that we have broken off into like accountability buddies where each person has somebody that they work with and they practice the script. So if you're going to ask me, you know, how can I just get my prescription to take it, can I just get my prescription to leave with? Then one of our team members is going to say, we can absolutely do that for you. And I'm curious what your plans are with your glasses, and just asking a very frank, curious question, nothing shaming or guilty about that. And if the patient says something like, I just want to get my glasses at Costco, I can't afford you guys, or I need a less expensive option, then the rebuttal or the response would be from our team member, well, it sounds like you need more affordable choices. And I'd love if you could sit down with our optical expert to go over those with you so we can make sure that your glasses match the exam lenses that we used in your exam today. Would that be helpful? And we all want to help our patients, and who doesn't want to be helped? And so I think that at least opens the door for a conversation to happen.
I would agree. We do much the same thing. I will typically counsel my team when patients say to me, I want a copy of my prescription, or more often than not, they're saying that to my optician or to my scribe if they're taking them to optical, if we were unable to do the handoff in the exam room. I've always kind of telling them the very first thing that has to come out of your mouth is absolutely, we're happy to do that. I think a lot of us are preconditioned when patients say, I want a copy of my prescription. The very first thing out of our mouth is, but let us, but allow us to. I think the first thing the patient needs to hear is, yes, I'm going to get what I asked for. So we will say, absolutely, we'll be happy to do that for you. And then along Larry's lines, we will say, what were you planning on doing with your prescription? Were you, because they will usually, I think you can do it in a way that doesn't make the patient feel bad, but they'll usually say, well, I was going to go to Walmart, or I was going to go to Costco. And it's because I'm assuming because of price. And so what we'd love to do is to show you some of we call them express bundles here, because we tend to stay away from the word value. I mean, sadly, I think value, most people, when they hear the word value, now they think cheap. They don't think value. So we use the term express bundles because we want to talk to them about the convenience and the ease that we're, but we will always counsel my staff to let them know our patients need to feel as though they can shop from us irregardless of their financial situation. So we have affordable packages that will deliver absolutely great vision and eye health, because that's what we're focusing on, is keeping their eyes healthy. But I think it's super important. The first thing that comes out of our mouth is, yes, we'll be happy to do that for you. And we do. I mean, we freely give them their prescription. We want to be their advocate. And a lot of our patients, when we measure our capture rate internally, our capture rate is usually about 80%. We find a lot of patients will take their prescription and shop, and then they'll come back to us and say, you know what, it actually wasn't cheaper for me to go somewhere else. So,
Mark, how do you finish on that?
Well, we're happy to help with that. And this is important too. People really don't like to be inconvenienced. So again, tagging off of what Dr. Keene said, we want it to be convenient for you. And at the same time, we also want to be absolutely sure that your eyeglass lenses match the exam lenses so you see sharp and clear. And I'm happy to help you. Do you have a range that you're comfortable with that I should be aware of? So it's along that same vein. The three of us, Dr. Keene and Dr. Golston and myself, have worked on this for, oh my gosh, for probably a couple of years, being sure that we have the express bundles, be sure that we're communicating as well with our vendors and also our labs and our manufacturers to say, hey, listen, I need a comparable, great product that maybe doesn't have the brand on it, so I can be able to compete when I need to at a level with Costco. And frankly, there's no reason why we can't. Patients don't want to be inconvenienced. Number two, they'd like to be sure that their eyeglasses actually match the exam lenses. On occasion, I'll have a patient say, well, what do you mean match the exam lenses? To which I respond, sometimes patients decide to try and get glasses elsewhere, and when they can't see out of them, they come to us to troubleshoot them. And frankly, we don't have any of the measurements or metrics to troubleshoot, so then you and I get stuck in the middle. So why don't you share with me what range you're comfortable with? I'll work within that range so that you could leave happy. Will that help you? Now, here's my closing on that. If you don't close, if you don't ask and close, you don't get. And more often what I find is we don't. We sort of leave it hanging out there somewhere like, well, we can help you with that if you wanted, or so there has to be value to it. The value is the what's in it for them. And that could be, I don't want to be inconvenienced. I want to be sure there's a match. I want to be sure that my eyes are healthy against sun damage. I want to be sure that I'm seeing sharp and clear. And it's often the case, they didn't know that we could actually provide them with an express bundle. It's not our go-to. And they look at our place and they go, oh my gosh, this is too beautiful for me to stay here. I need to go where there are concrete floors and frame boards that look like it's a wall of mud. And so, you know, when we hold that back and we say, oh my goodness, I'm happy to help you with this. And then we close at the end with, will that help you? We're more likely going to see our capture go up in our optical as a result.
You know, my takeaway from this section of the conversation is that each of you realize that being compassionate and thoughtful is free, and giving information is free. And so whether we've had a lot of typed comments from people so far in our comments section around, you know, we do this at Costco, they can't do that. And what I hear each of you saying is, let's think about inspiring our team through leadership at a time where we're all starting to reopen, to take the things that were always common sense to do, like giving information, take a moment and say, I get it. I know you want to go online, but before you do that, remember, you spent a lot of time and effort with the doctor in the exam room. Let me explain why it is that we need to match what the doctor's done to what your glasses will be. I think you guys have made a great point. Mark, before we go to the next section, your last comment?
One more thing. You want to check in with your phone teams, either your call center or with your receptionists that answer the phones, because people don't like conflict and confrontation. So often they'll find a way to sneak out of the office, then call the front desk and say, will you send me a copy of my prescription? Yep. And often what I hear is, yeah, we'll be happy to do that. Where do you want it to come? So really build that dialogue and make sure that everybody has the ability to say, we're absolutely happy to help you with this. May I ask you a question? Who are you thinking of having make your glasses for you? XYZ. Oh my goodness. Hey, we'd be happy to help you with that. Lead it to a close, leading to, would you like me to set an appointment with you to come back so that we can be sure that your glasses match the exam lenses and you'll be happy?
Right.
All right.
All right. So talking about managing the dispensary itself, let's just talk. Susan, are you going to be having patients specifically schedule appointments for pickups, repairs, you know, new selects? How do you see yourself doing that, and contrast it to whatever you had in play before the pandemic?
So yes, absolutely. Right now, everything is by appointment only. But prior to that, you know, obviously we celebrated when we had walk-ins, and most of our, so yesterday was our first day being open. We've got 4 locations which have 2 doctors in them at all times. This week we have 1 doctor, and that doctor is seeing patients at about 30%. So it is a very different world for us this week, and we're slowly going to ramp up over the next few weeks. But we have spaced a lot of things out in our optical. We're doing schedules. Well, we always, pre-COVID, we would schedule our dispenses. So we were not really big on letting patients just say, here are my glasses there, because inevitably they wanted to come in and pick up eyewear when our doctors were the busiest in the optical with patients. So we, years ago, kind of saw the value in scheduling dispenses to kind of have that even flow throughout the day. One of the things that we've talked about doing, we certainly did this while we were shelter in place. We would, you know, we had eyewear that we were still fabricating and mailing to patients. So we've had conversations around, does it make sense for us to just go ahead and pre-adjust and let patients know, for your safety and convenience, we're going to go ahead and pre-adjust your eyewear and send it and mail it to you. Yes, we will have a shipping cost. And we've talked about what's the best way to handle that. Is that something that we just let patients know there's an XYZ cost for shipping? Or would it be better to just go ahead and include that in? Because they say time is money. And when you look at the amount of time it takes to go ahead and then see the patient the second time to dispense the eyewear, the shipping cost at the end of the day really is not that big of a deal. So I think that we are leaning more towards safety and convenience for the patient, pre-adjusted ship eyewear.
Larry, how about at your practice?
Yeah, a lot of the same things, Scott, that Dr. Keene mentioned. We are doing curbside dispenses. We're only letting a certain amount of people into our office and our optical at a time. You know, one hard thing that we've noticed is that it's hard to see what a frame looks like when there's a mask over your face. And so we've developed an area of the office when we're down to, like, you know, the last few frames the patient's interested in, to kind of like be able to pull their mask down, try on a few frames, and then after they make their final selection, wipe down that area, wipe down any frame that the patient touched, and fill the order that way. The good news, I think, that from a safety standpoint is that if y'all's inboxes are anything like mine, we're getting like anywhere from 5 to 7 emails a day with good practices that are effective for maintaining an optical while maintaining safety. And I think that our patients want to feel that. And for the few patients that we've seen since this all started, some of them have even said that we're going overboard on our practices, which I love to hear, because I'd much rather go overboard than underboard. And the way that we've gotten a lot of our ideas along from the emails and industry information out there is from our team. And so I want to take a minute to kind of talk about how we got that information from our team, because they're the ones who are doing the work every day. And we realize that all of us practice in a bit of a different setting. You know, some people practice in standalone buildings, some people are in strip malls, some people are in office buildings. And so from research available, we know that the number one ingredient of success to the highest performing teams, or any human group for that matter, is called psychological safety. And I'll define that because sometimes when I have clients that I work with on a consulting nature, they look at me like a deer in headlights when I say that word. Psychological safety basically is, do I have the permission and comfort of showing up as myself within a group of people I'm with? That means, can I raise my opinion? Can I feel safe when I do so? Is it okay to make mistakes, knowing that I might learn something along the way? And all this knowing that I won't be condemned for anything that I might bring up. So that is something that it's taken me a while to engender with my team members, so that they know that if they have an idea, they can voice it. And there's a number of ways that we can build that safety as it relates to our teams. And, you know, I'd be interested in anyone that is listening right now to offer any ideas that they've done to create that form of safety in their offices. All this to say that our teams have a tremendous amount of ideas. The collective intelligence of our teams can come up with such great ways in our individual, unique practice settings, deliver care that feels safe to a team, that feels safe to the patient. And I think that our teams who are on the front lines doing the work every day are a tremendous resource for us as we kind of figure out how to do this in our own practices.
Mark, let's riff off of that. There have been a lot of questions based upon something that Larry just said around managing in the optical the disinfection of frames. We've had some other experts in other sessions talk about everything from soap and water to UV wands. Could you give some insights that you've learned that you could share with this group of attendees today about some of the options they have to keep their frames and their dispensary in general clean and safe for the patient?
I would share that probably one of the best pieces that I read recently was something that was released by Safilo on how to disinfect your frames. I've had people ask me, can you use bleach? You know, can you use denatured alcohol? What's the difference between that and isopropyl? And can I use what I use to clean off the lenses with? And I think a couple of things. The patient needs to really see, relating back to what Larry said too, you know, a psychological safety from the patient point of view, that we are cleaning lenses, that when they are resting their chin, you know, for a test, we're cleaning that in front of them, that they recognize that we're handling the frames and actually cleaning that frame and explaining to them, I'm making sure that this frame and every frame is safe for every patient to be able to try on comfortably. And that's really the main thrust. I think that I would relate to that Safilo piece that was just released in the last week on disinfecting frames, and at the same time having the patient understand, you know, the safety as well. I think Dr. Keene, you've also worked with your team as far as disinfecting frames too. You could probably add to this nicely.
We have, and largely some of the things that you've talked about. We did not. I think there's I don't know that there's a consensus around the UV wands or the UV boxes, so we have not done that. We've used some of the disinfection methods that you've talked about with the alcohol or the peroxide solutions. One of the things Larry spoke about, and I wanted to just talk about the team. I think it's super important. One of the things, we set our team down, so we have meetings, you know, once a week, and our team was not furloughed, so we had Zoom conferences with them. I think they came in the office when we were seeing emergency patients. They averaged working probably 2 hours a week. but we did some, at-home learning and videos and things like that so we could stay in touch. And as we started to ramp back up, we just basically had conversations with them around what makes you nervous about coming back to work. What makes you nervous about being out in public? What are the things that are on your mind that are concerning you? We've kind of instructed all of our front office team that answers the phones. When you call patients, if they have any hesitancy about coming in, write down specifically what they say. Not just these 3 people didn't want to come in. Was it, I don't feel safe. I'm not confident that everything, and so we've got a marketing team, and I said, we're going to take the feedback that we get from our own team and our patients about the things that are making them nervous, and we're going to try and develop plans in the office and marketing plans to specifically address the things that they're concerned about.
One of the things that we've heard from some feedback today is that different practices are taking different actions that they have also duplicated from their exam process. For example, a private dispensing room that they may now just use for that activity, again, to get patient safety. Outdoor dispensing, where ingress, go ahead.
I was going to say, so that's why when we redesigned our office, we had set aside a kind of a private dispensing room, largely used for those patients who were having some type of issue when you kind of want to get them away. But in hindsight, it's actually worked out really well because patients can actually go into this private room and then remove their mask and see themselves and, kind of make a decision, and they're not out in the office.
Yeah. And I think all of it goes to that point of psychological safety. I think we always have had that sort of at the core of optometric care delivery, but it's just a time where it bubbles up to the top. We've even had somebody say, I'll just leave the shipping fee for free and I'm going to cut into some profits so somebody that's thinking about buying somewhere else won't. So thank you for everybody sending in so many interesting ideas. Ultimately, this is going to adjust the way that a lot of things we do in optical are going to be managed for a long time. I want to shift because of time to talking to the vendors, right? It's intimately related to optical and dispensary management is vendors. Oh, and by the way, I did get a notice from the GPN Technologies team. Every attendee is going to be getting a post-session handout, and it's going to include the information that Mark mentioned from Safilo. So by attending, we're going to try to give you the easy button and send you some things automatically. So as a benefit for your attendance, you will be getting some very important materials that you don't have to research on your own. So let's talk about vendors. At this point in time, Mark, are you looking at vendors differently, the high end versus the low end? Are you changing the number of vendors you work with? Are there things you need to do that you think are the first and second things that need to be managed with your vendors?
Well, for simplicity, I don't want to take a lot of time with vendors in the office with so many other things going on. So I'm really relying on the vendors, using a vendor agreement statement of what I absolutely need. And in a very kind way, but I do have expectations. I don't need to pick out all the frames. I need them to tell me what are the frames that are really working best in my demographic. And those are their inline products that they're bringing fresh that they want to show us. I also want to know from them, and what products do you have that you are now turning into a high margin product that, is 60% off that I could use for my patients who say, look, I don't have 2 dimes to rub together. I need my glasses, but I've been out of work, or my husband's been out of work, or my wife for a period of time. So I want to know that as well. We want to be expeditious with this. So those are a couple of things in particular that we're really doing with our vendors. You know what I've got on my boards, and I gave you 3 columns to work with. I need you to make me wildly successful with your frames. I don't want frames sitting on the boards not paying rent. And so to pay rent means they're turning. And I could fall in love with a frame myself, but it's just my own emotion. I need to know what are those frames that are really rocking it in our demographic. And I'm sure that Susan and Larry would add to that.
Larry, do you want any of the frame or lens reps in your practice right now?
Yeah, I think that if it can be avoided, just like anyone that might step into our office, if it can be avoided right now, we'd like to avoid it. And so there might be some exceptions where we need to have a vendor come in. I know that a lot of the vendors that I've spoken to are grounded. In other words, they're companies are not allowing them to visit practices, so it's not even an option for some. But I would err on the side of whatever we can do with a virtual meeting, or as Mark said, by having them look at our account and our demographic and maximizing the quality of which frames are on our boards for whatever amount of slots they're permitted to have on our boards, would really make a ton of sense right now. I do think that, I mean, something that I've learned throughout all this is that virtual meetings can be very effective. And so even FaceTime or, showing frames over the internet, we've actually done virtual try-ons with our patients. So if they have frames that they're interested in, they can get them from our office and try them on, and then we can jump on a call with them and do like a virtual fitting. So there's no reason we can't do that with our vendors. There's no reason we can't, have the vendors show us the frames and have us pick from those if that's how we choose to purchase our frames. But the overarching thing for us is, give us a really compelling reason to have you in the office. And if you are coming in the office, we're going to treat you like any patient, where we would scan your temperature, ask you a battery of questions to make sure that you're feeling okay, and also have the vendor sanitize their hands and wear a mask. So those are the kind of things that we would expect of anyone stepping in the office. Even postal, service deliveries from UPS and FedEx, everything that we're doing is, kind of uniform across the table. The only thing that I will mention for the postal deliveries is we do have, kind of like Dr. Keene has a separate area for dispensing, we have a separate area for deliveries, and our office is set up such that they can walk in with their own code, drop off their deliveries, and then close the door behind them, so we don't even have to interact with the postal deliverers.
Susan, what do you have to add for your frame and lens vendor relationship management?
So honestly, right now, I can't imagine having a vendor, come into the office for the next little bit. Even when we do, so again, having multiple locations, we've talked about, currently right now, like a lot of offices will have vendors that have traditionally visited the locations. I think going forward, we probably are looking more to get away from that and maybe just do like a centralized purchasing. But for the short term, I think it's all going to be virtual.
Mark, let's come back to this idea of general dispensary management as you expressed it earlier. Hey, Jane, we've got, the 3 columns for you. There's some folks who are in attendance who are just thinking about that now because of the pandemic's effect on how they're going to see reps. Without going into some of the great consulting work you do, that you could do this for a 2-hour session and keep everyone captivated for all 120 minutes. How would you recommend somebody start by saying, listen, I've got 12 of your frames, help me get the best sellers? What kind of language should they use? We're getting some questions about that.
Okay. Well, if we're using that particular vendor, let's assume that we are, and we've allotted X amount of geography on our board space, then I've got to communicate with them that reaching back again, I need to understand what frames are selling through and which ones aren't. I don't want those ones sitting on the board that aren't selling through. So we make it important for the vendor to understand, when you see that this hasn't turned for the last quarter or 2 months since you were in, we need to be aware of that. And then we'll be aware of what is your plan to take that back and to be able to provide us with something that probably will turn in its place. We use Edge Pro to be able to determine, what are our frames that are actually selling through. I mean, this is an Edge Pro webinar. This is I Thrive, and thank you, Clear Vision, too. We need a really good understanding of what product mix we're using, how much of that we're using, what are our niche frames, what are our core frames, what are our specialty frames, and then literally, I'm not going to be responsible for whether they turn or not. I have an agreement with my vendor, and my vendor is responsible for making sure that these turn. That's not typically the way we do business. We typically kind of hope the frames are going to sell on the board. But if we were really doing it right, then we would have the agreement with the vendor to say, look, we're partnering. And I've got other companies that would love to have those 3 columns that you've got up there. I'd like to give you 5 columns, but I need you to help me be successful with your product.
Anything to add as it relates to that topic, Susan or Larry?
No, I agree. I think one of the things, the practice that I bought years ago, for whatever reason, I think the almost had a culture of bringing the frame reps in, and my opticians would just pick the things that appealed to them. Well, then you end up with frame boards that only are with frames that only our opticians would wear. I think it's more incumbent upon us to really look at our reps. They are the experts. They have the product. They know what's selling. And as Mark said, we have our sign of vendor agreement to basically say, here's how I'm going to service your account. And it's incumbent upon them to keep our boards full with product that's moving. I do think there have been times in the past when I have not gone deep enough with a frame that would move. In other words, I think sometimes we're guilty of just getting one or two of something. You know, if I've got a hot seller, something that's really going to sell, I have found that I work better with the vendors who make me aware of that. And then we keep the hot sellers, we stay deep with those. So the minute you sell one, you know, you've got a replacement. Yes, Mark.
No, I'm sorry, not cutting you off. You finish. I just wanted to throw up my hand to add.
No, I was going to say that is exactly what we do. So I think I probably learned it from Mark or on a GPN webinar, but the whole idea of the vendor relationship, these are like apartments and they have to pay rent. If they're sitting there and they're not moving, they're not paying rent.
Mark, finish and then Larry? Sure.
Yeah, I want to comment that during these times right now when we don't want to walk patients around to the frame boards of confusion, you know, we're looking to help the patient. So I'm going to add this. I think it's really important to excite the patients about the new collections that have just arrived in optical. And that's how I start. The new collections that have just arrived are stunning. I don't care if I've had them sitting there throughout this entire COVID event. For that patient, they're brand new. So it's really exciting, the emotion. People buy with emotion and then they justify with logic. So I want to imagine too that as we're helping patients make decisions, that often as opticians, we're saying to the patient, so what do you think of that one? And it's really important to say, I can think of frames that are going to look so extraordinary with your features. I can't wait for you to see them. And what we know is that often drives the patient, that consumer, to realize, oh, I'm working with an expert. That's helpful. Also, oh, if you can already think of things that are going to look great, help me out, because when I look over at all of those frames, I go into choice overload. We don't want that as well. So instead of, what do you think of that one? I think it's important to say, imagine your closet, your sense of style, your mood, and when you think about it, begin to imagine how you might see yourself wearing this one. And because when we say, what do you think of that one, we just gave the patient permission to say, I don't like it. And we're really working to be expeditious right now because we're seeing fewer patients congregating at a time, limiting our schedules. So we really need to be efficient when we're in our optical. And please, for the sake of the audience, I'm sharing ideas. Some of you may already be aware of this. Some of this I might have coached with you in the past, and it's a reminder. And I'm also not talking down to anybody. We all have our sense of style. But in this era, I don't want to be Sears and I don't want to be Blockbuster.
Larry, add some context, and if you can, add in anything more that's already been touched on around using data and information to make the best possible vendor relationship decisions.
Yeah, I think that Mark and Susan have done a great job talking about frame board management and working with vendors to maximize our frame spaces. And Mark's last point about, you know, the boards of confusion that our patients will look around and say, I don't find anything in your office that I like as glasses. And then when they actually sit down and work with an optician, the optician starts to select glasses. All of a sudden they find 5 choices they can't choose between. And so as it relates to what we were speaking about earlier in safety in our dispensaries, we do have signage up that says, please ask for a team member's assistance and do not try on frames by yourself, because we don't want our patients walking up to our boards and trying on this frame and putting it down, and then, you know, it knocks over 3 other pairs of glasses that then when they have to touch those as well. So we're not really allowing our patients to pick up glasses. We're bringing them to the patient to try on, and then we're taking those patients and using our disinfection method. As far as what also might not be touched on is that we do have relationships with some of our optical labs where they send us frames to do consignments. And so these frames are ones that Susan alluded to as our express bundles. They're not our first choice, but if a patient expresses they need help financially, we do have frames that we can bring out and show the patient that can simply be ordered through the lab of our choice, and they're already at the lab. So we keep the frame in office, we send the order in, and the lab starts to make the job, and they have that same frame at the lab. And so that can also save a lot of back and forth with sending frames off and helping to expedite orders. As far as the software, I do feel strongly that the Edge can help with how we understand what frames are moving and what frames are not moving. And I know that for us, the Edge software is so deep, and the amount of analyses that it can perform, that we had time on a phone with one of the Edge trainers to help our opticians learn how to mine that data. And they were very helpful and available. And so for all the Edge users out there, those who are considering the Edge, I will say that the software is robust, and it's has a lot of computing power, and it takes some time to learn it. So be patient and ask for support from Edge, and you can get the information you're looking for.
Folks, here's the thing. You've stuck around for a long time, and now we're going to get to something that is really going to lean on the expert's experience, and that is talking more about how we actually interact with others in the dispensary, our social distancing at a time of, dispensary needs. Our patients need us, and there's a number of them that are ready and willing to purchase from us. One of the comments I got, I'd like to start with, perhaps Susan, you could hit on this, is we not only have a responsibility to make the patients feel safe, but our staff as well, right? They need to be doing good things at home, taking care of themselves, managing themselves away from the clinic as they come in. Could you give us any insights around how you've taught your team, both at home and in the practice, to deal with patients in the dispensary?
Right. So one of the things that we have done with our team, of course, our team right now are wearing scrubs. We made the decision to provide that, and we have a different one per day by color. So just kind of basic things that we've talked to them about, disinfection when you get home, just like we have sanitation stations in our offices. They need that in their garage, or, some things that they can do so that way they know that they're entering their environment and being as safe as possible when they get home to their loved ones.
Do you pay for the scrubs, by the way?
We do.
Okay.
We in our offices, we've made the decision to close our break room, which was kind of a hard decision to make, because it's one of those things that we enjoy, when our teams get together and are laughing and are social during the day, and yet we're aware of the fact that here we are talking about social distancing, and yet we've got 7 people crowded around the table in the break room. So for the short term, we have kind of said our break rooms are closed. Which was really a hard thing to do because it kind of goes against our team culture. We have weekly team meetings, and so in our break rooms right now we are not doing those because you really can't social distance with 12 people into a room. So there are some things that we've had to do both with the team in the office, and just some things, we've talked about just the value of getting out and exercising, eating healthy, making sure that you take your vitamins, these kind of things, because we're aware of the fact that if our team has healthy immune systems, they're going to stay healthy. So we want them to know, not only do we care about you here at work, but we care about you at home and your families as well.
Mark, there's a lot of face-to-face interaction between opticians and patients, measuring seg heights, pupillometers. I've seen pupillometer, breath shields. Please talk about some of the things you think should be adjustments that opticians and those working in the dispensary should take to maximize safety for all.
Well, I think this is probably going to present this new age where the Sharpie is going to disappear, and we're actually going to use some of the technology that we clip onto a frame, hand to the patient, and we're able to maintain some distance as well. I'm seeing shields. I'm hearing about shields for pupillometers, and being sure that, first of all patients are masked. And I'm not sure that we had this conversation in the very beginning about all patients being masked, but, and making it about the patient. For your benefit, for your safety, I'm going to provide you with this mask. And I think that's important as well. Being able to maintain that distance from the patient when taking the measurement is important. And yet if it's a Sharpie and a PD ruler, you have to be right up in front, right up in that person's face to be able to do that. So that's That's vital. I would say that what I am recognizing is that there are people that are saying if it's a return patient, we already have their PDs. We don't need to do that again. And we can get some distance if we're using a Sharpie. But I think, we look at how things are going to change, going through this, this pandemic period, how things are going to change probably permanently. And I recognize that there is the hand washing in between. There's the re-gloving. Many practices are using gloves in between patients for measurements, for example, and then pulling those gloves off. I know that of opticians that have said, well, I'm turning my head to the side and I'm one-eyeing this, so I'm not breathing or taking in what they're doing. I'm not contributing to it. So those are some of the things that I'm hearing from clients that I've worked with, and the way that they're protecting themselves and having the patient understand, and for your safety and benefit, this is how we're going to measure this. I don't know of anybody that's saying, will you stick a credit card close to your head and let me guess what the numbers are?
Yeah, Larry, pick up on that. Obviously, space will dictate how many patients, what kind of load you can have in the dispensary, but also the gloving topic, right? If we're in an influenza vaccine clinic in the fall, we think nothing of a nurse administering 75 flu shots in a day and using 75 sets of gloves. But it feels really awkward for ECP practices to think about 75 sets of gloves for 75 dispensary patients. Just give us some insights that you've got around dispensary and social distancing and safety.
Yeah, thanks, Scott. I think about, for us, the initial push was for everybody to wear gloves. And I think as medical practitioners, we all know that the minute we touch something with our gloves, they're not sanitary anymore. And so we were doing it initially for the psychological safety of our patient from their standpoint, as Mark said. And I think that we have to stress over and over that what we're doing for our patients. So we make it about them, not about us. And at the same time, realizing that, Dr. Bryant, my associate, asked a great question to our team in our team huddle at the end of the day yesterday. If we found out that somebody in our office as a patient had COVID, would you feel safe with what we're doing right now as a team, so that you felt safe that you weren't going to catch it? And I thought that was a brilliant question, because it makes people really think about the reality of the situation that we're in. And so what we landed on as a team is that the doctors and the medical assistants were going to wear gloves, and then the opticians and the patient care coordinators at the front desk are not going to wear gloves right now. And a lot of that decision was made because it's hard to get these gloves. I mean, it's hard to get the PPE around the country. And so we wanted to kind of find a balance between being responsible for it with our patients and our team, and yet also for not using resources that might be better used elsewhere.
It's a really good point. And hand washing, I've said this on every webinar, and I continue to read the scientific literature. Hand washing is a very effective way, if this virus happened to be on surfaces, of eliminating the exterior lipid layer of that virus and killing it on contact. And so there's nothing irresponsible as long as, if you don't use gloves, as long as that conversation and information is shared with the person that you're interacting. So I would say that that is a very thoughtful comment. And of course, we want the PPE to be available for those who are on the front lines of absolute critical healthcare. Not that what we're doing isn't critical, but I see, Mark, you're raising your hand. Keep going.
Well, thanks. It brought up something else that occurred to me too, is that, there are face shields that are available. And I'm sure that our suppliers, Amcon and I Design, and certainly these other providers have this PPE. And so there are face shields that, will lift up and cock back down when you were saying, how can you work with your patients? You feel safe and have them feel safe at the same time, whether it's a cough or whether it's a sneeze. And then certainly, as I had shared, a number of people were saying, we're going to be using gloves because, again, it was back to perception. But that number one thing that I keep hearing from Anthony Fauci is wash your hands frequently and keep your hands away from your face.
Larry?
Yeah, thanks, Mark. I agree with that 100%. And what's so easy to do is to get busy with your day and totally forget that 2 hours has gone by since you last washed your hands. And so we have a system in place where our patient care coordinator, we use a software called Blue Note, which if you hit a message on Blue Note, it pops up on every computer screen in the office. And every 30 minutes, she's now pressing that button that says, please wash your hands. And every single time I've seen it come up in the last week, I've had to remember, oh yeah, let me go wash my hands. And so it brings up another point that not only do we need reminders and a system in our offices to remember something as simple as washing our hands, but also that as leaders in the office, if we're asking our teams to do something and we're not doing it ourselves, then I think that that's the grounds for poor leadership and poor followership. And so I make it a point that, you know, I wash my hands and I'm wearing a mask and I'm modeling the behavior that I want my team to be exhibiting while they're seeing patients.
So we had a couple questions that came in. These are very quick. We haven't covered in depth the patients and optical at a time, but I think you need to take the 6-foot rule, measure your practice. We've had Dr. Lori Lippiat speak in other sessions about managing a number and holding strong to that number and really empowering your staff to develop that psychological safety within their group and others, so they can message that to people who want to crowd. I've also heard questions around hand washing best practices. Can I sanitize gloves with hand washing or hand sanitizer? Again, these are things that are available outside the purview of the session. I'm sorry we can't answer every single one of them. But what I want to do is we're kind of getting to the end, and these attendees have stuck with us the whole way through, is give each of you a chance to really hit one more important thing that each of them would be able to take back. Susan, let's start with you.
So the one thing that we didn't talk about, I know we spent a fair amount of time talking about frame vendors. I would encourage you with your lens vendors, don't be afraid to just talk to them. They have asked, you know, I reached out to my vendor and I said, you know what, I want to be able to offer something to my patients who are struggling financially. And would you be willing, you've done it forever, giving me 50% off second pair, would you be willing to do that, not just for the patient, but also a family member? And they said, absolutely. So for the next 90 days, we are offering an in-house, you know, buy one, get one for either yourself or a family member. So first of all, you don't get anything if you don't ask.
Great advice.
The second thing I would say is, you know, we, independent doctors, the doctors that are on this call, we're here because we think outside the box and we're successful. We've been handed a set of situations with COVID-19 that no one could have predicted. But I think if we do all the things that we're doing right now, educating ourselves, best practices, we will find a way to come out of this better than ever. So.
Mark, please give us some closing thoughts from your perspective.
Well, lead patients to help them opt in. Ask fewer questions. In other words, don't answer questions they didn't ask. Simply lead. Carry the pad with you in to pick up the patient. Mimic and use doctor words when directing the patient. Lead and they will follow. And the other thing that I'm going to share with you is make sure everybody on your team can respectfully answer the question to the patient who says, I just want to get a copy of my prescription today, because with discretionary dollars and so many people needing the service, can you imagine how many people in the last 6 weeks have looked at their partner and said, oh my gosh, I need a longer arm to read with? So we want to really make sure that you can answer that question helpfully and then say, would it surprise you to know that when patients find out that we have products to meet your needs and your means, that they're happy to have us do that for them? Really build your dialogue around that. I would not say we have packages starting at. I would ask the question, what range of cost should I be respectful of for you? And that provides more engagement. What you'll find is people will generally give you a number higher than whatever you tell them your package starts at. Discretionary dollars, we can look for patients to look for other solutions for their glasses. So just be prepared to answer that question and you'll capture more of your patient's imagination and also keep them in your practice.
That's also awesome. And Larry?
Yeah, this is going to dovetail great on what Mark just said. And, you know, I think communicating with simplicity and clarity is very important. If during COVID we aren't efficient and effective with our communication, we're going to lose our patients. We're going to lose their minds. We're going to lose their attention. Less is more. I think that it's important to remember that there's two things that as humans, we're always trying to do, which is one, survive and thrive, and two, conserve calories. And so number one, survive and thrive, we've got to communicate something about our product offering that helps them survive or thrive, or why would they be interested? They've got a lot on their minds right now. As far as conserving calories, there's a limited number of calories that we're each going to burn each day, whether it's through physical or mental activity. So if we're using a lot of dialogue that's going to confuse them and it's going to take longer to deliver, number one, we're going to keep these patients in our practices longer than we want or they want to be in there. So we really want to be efficient with their time. But also, they're not going to be able to spend the energy to understand what we're saying because they are spending energy with their mental capacity, understanding what to do to navigate their world every day. And so I think it goes back to how do we engender a communication system with our patients, for our patients, that is simple and clear so that they get right to the point and they can make a good decision that's going to help them. I agree with Susan Keene as far as we are going to get through this. I think the message of hope is really important as leaders to share with our team and our communities. And at this point, it's just a matter of how we can do this with grace and with confidence.
On behalf of all of these folks who have attended this session, I can't thank each of you enough for giving us your time and your expertise. Susan, Larry, Mark, thank you very much for your time today.
Thank you.
Absolutely delighted. It's an honor.
On behalf of the GPN Technologies team, thanks to everybody for attending these Next Step webinars. This one about dispensary management will also be available for viewing after this session, so you can share it with your team or with your friends. Please do. And check out all the other webinars at iThrive.net. With that, I'm going to say have a great day. Have great success in reopening your practice. Be great at all you do. Thanks today.
Thank you.
Thank you.